Over 60? If you're getting short of breath more easily than before, this may not be normal aging. Many serious lung problems begin quietly, with small changes most people ignore. A little breathlessness, a lingering cough, or feeling tired all the time may seem harmless, but they could be early warning signs your lungs are slowly failing. The dangerous part is that lung damage often progresses silently, and by the time symptoms become obvious, the damage may already be severe. In this video, you'll learn 5 critical lung warning signs people over 60 should never ignore. Recognizing them early could help protect your breathing, your energy, and your overall health. As we age, our lungs naturally lose some of their strength and flexibility. After the age of 60, lung capacity slowly decreases, oxygen exchange becomes less efficient, and the muscles that help us breathe may weaken. While some changes are expected with aging, serious lung problems are not a normal part of getting older. The danger is that many lung conditions develop gradually and silently. Diseases like chronic obstructive pulmonary disease, pulmonary fibrosis, and long-term lung inflammation often begin with mild symptoms. These early signs are easy to dismiss as being out of shape, tired, or simply getting older. Over time, reduced lung function affects the entire body. When the lungs cannot deliver enough oxygen, the heart has to work harder, the brain receives less oxygen, and energy levels drop. This can lead to fatigue, dizziness, poor concentration, and increased risk of heart and brain problems. Many people over 60 have additional risk factors that place extra strain on their lungs. Past smoking, secondhand smoke exposure, air pollution, previous respiratory infections, and long-term medication use can all contribute to lung damage. Even people who never smoked may develop lung disease due to environmental exposure or weakened immunity. Another reason lung problems are often missed is that symptoms may appear slowly. You may adapt without realizing it, walking more slowly, avoiding stairs, or limiting activities to prevent shortness of breath. Over time, these adjustments can mask serious decline in lung health. Repeated respiratory infections are another warning sign that lung defenses may be weakening. As we age, the immune system becomes less efficient at clearing infections, making recovery slower and complications more likely. It's also important to understand that poor lung health doesn't just affect breathing. Low oxygen levels can worsen blood pressure, strain the heart, reduce physical strength, and accelerate overall aging. This video is designed to help people over 60 recognize when lung changes are not normal and should be taken seriously. It is not meant to replace medical care, but to increase awareness so you know when to seek professional advice. In the next sections, we'll go through 5 lung warning signs that often appear early. Some may seem small at first, but together they can signal that your lungs need attention. Let's begin with warning sign number 1. One of the earliest and most common lung warning signs people over 60 should never ignore is shortness of breath during normal daily activities. This symptom often develops gradually, which makes it easy to dismiss as normal aging or being out of shape. You may notice that simple tasks, such as walking at a normal pace, climbing a few stairs, carrying groceries, or even talking while walking leave you feeling unusually breathless. Activities that once felt easy may now require frequent pauses to catch your breath. As we age, a slight decrease in lung capacity is expected. However, persistent or worsening shortness of breath is not normal. When breathing becomes difficult during everyday activities, it often signals that the lungs are no longer delivering enough oxygen to the body. This symptom occurs because lung tissues may become damaged, inflamed, or stiff. Conditions such as chronic obstructive pulmonary disease, lung scarring, or long-term airway inflammation reduce the lung's ability to move oxygen efficiently into the bloodstream. Many people over 60 adapt to breathlessness without realizing it. They walk more slowly, avoid stairs, limit social activities, or stop exercising altogether. These adjustments can hide the severity of the problem and delay diagnosis. Another danger is confusing lung-related breathlessness with heart problems or general fatigue. While heart conditions can also cause shortness of breath, lung issues often worsen with physical activity and may be accompanied by coughing, chest tightness, or wheezing. Shortness of breath may also appear during rest or while lying down in more advanced cases. Some people wake up at night feeling unable to breathe deeply. This is a serious warning sign that should never be ignored. A key question to ask yourself is, has my breathing changed compared to 6 months or a year ago? If the answer is yes, and the change is noticeable, it deserves attention. Breathlessness related to lung problems often comes with other subtle signs. You may feel unusually tired after mild activity, experience dizziness, or have difficulty concentrating. These symptoms occur because low oxygen levels affect the brain and muscles. People who smoked in the past are at higher risk, but even non-smokers can develop breathing problems due to air pollution, occupational exposure, infections, or weakened immunity. Aging lungs are more vulnerable to environmental damage. Another red flag is breathlessness that worsens over time. If you find yourself needing more frequent breaks or avoiding activities you once enjoyed, your lungs may be struggling more than you realize. It's also important to distinguish breathlessness from anxiety. Anxiety-related shortness of breath often comes with rapid breathing and a feeling of panic, while lung-related breathlessness tends to feel like you simply cannot get enough air, even when calm. Ignoring this warning sign can lead to serious consequences. Chronic oxygen deprivation places extra strain on the heart, increases blood pressure, and raises the risk of heart failure and cognitive decline. Early detection can make a significant difference. Treatments may include breathing therapies, medications, lifestyle changes, or pulmonary rehabilitation. When addressed early, lung function can often be preserved or decline slowed. If you notice increasing shortness of breath, do not wait until it becomes severe. Seek medical advice, especially if symptoms interfere with daily life. Breathing should not feel like hard work. When it does, it's your body's way of asking for attention. Next, we'll discuss warning sign number 2, which involves a persistent cough that many people over 60 mistakenly ignore. A chronic cough is another major lung warning sign people over 60 should never ignore. Many older adults assume a lingering cough is caused by allergies, seasonal illness, or throat irritation. However, when a cough lasts for weeks or months, it may signal an underlying lung problem. A cough is considered chronic when it lasts longer than 8 weeks. It may be dry or produce mucus. Some people cough occasionally throughout the day, while others experience frequent coughing fits, especially in the morning or at night. Chronic coughing occurs when the airways become irritated or inflamed. Conditions such as chronic obstructive pulmonary disease, long-term bronchitis, asthma, or lung scarring can all trigger persistent coughing. Over time, repeated irritation damages the airway lining and worsens symptoms. Many people over 60 ignore a cough because it does not cause severe pain. Others believe it is simply a leftover symptom from a cold or flu. Unfortunately, coughs related to lung disease rarely resolve on their own. One concerning sign is coughing up mucus that is thick, discolored, or foul-smelling. Yellow, green, or brown mucus may indicate infection or chronic inflammation. Coughing up blood, even in small amounts, is an urgent warning sign that requires immediate medical attention. Another red flag is coughing that worsens with activity or exposure to cold air, smoke, or strong odors. This sensitivity suggests that the airways are already compromised. Chronic cough can also disrupt sleep, leading to fatigue, irritability, and reduced immune function. Poor sleep further weakens the body's ability to fight respiratory infections. Many people adapt to coughing by carrying water, cough drops, or avoiding public places. Over time, this coping behavior can mask the seriousness of the problem and delay diagnosis. Past smoking is a major risk factor, but non-smokers are not immune. Long-term exposure to pollution, chemicals, dust, or secondhand smoke can irritate the lungs and cause chronic coughing. Another often overlooked cause is repeated respiratory infections. If you find yourself getting bronchitis or pneumonia more frequently, a chronic cough may be a sign that your lung defenses are weakened. A persistent cough can also strain the chest muscles, cause headaches, and increase pressure in the lungs. In severe cases, coughing fits can lead to shortness of breath or dizziness. It's important to notice changes in your cough. Ask yourself, has the cough lasted longer than expected? Has it become more frequent or severe? Is mucus changing color or texture? Does coughing interfere with sleep or daily activities? If the answer to any of these is yes, your lungs may be signaling a problem. Early evaluation can help identify treatable conditions and prevent further lung damage. Tests such as imaging, breathing tests, or infection screening can provide clarity. Ignoring a chronic cough allows inflammation to worsen, making future treatment more difficult. Addressing the issue early can preserve lung function and improve quality of life. A cough is not just a nuisance. When it persists, it is often a warning sign your lungs should not be ignored. Next, we'll move on to warning sign number 3, which involves chest tightness or discomfort and is often confused with heart-related pain. Chest tightness or discomfort is another important lung warning sign people over 60 should never ignore. Many people immediately associate chest pain with heart problems, but lung-related issues can also cause pressure, tightness, or discomfort in the chest, especially during breathing. You may feel a heavy sensation, squeezing, or tight band around the chest. Some people describe it as an inability to take a deep breath or a feeling that the chest will not fully expand. This sensation may come and go or worsen with physical activity. Lung-related chest discomfort often occurs when airways are inflamed, narrowed, or blocked. Conditions such as chronic bronchitis, asthma, lung infections, or scarring can restrict airflow and create a feeling of pressure in the chest. One reason this symptom is often ignored is because it may not feel sharp or severe. Instead, it can feel dull, uncomfortable, or annoying rather than painful. Because of this, people may delay seeking help. Chest tightness caused by lung problems may worsen with deep breathing, coughing, or exposure to cold air. Some people notice discomfort when lying flat or during mild exertion, such as walking uphill or carrying objects. Another red flag is chest discomfort accompanied by wheezing or noisy breathing. These sounds indicate narrowed airways struggling to move air in and out. Wheezing is often more noticeable during exhalation. People over 60 may also confuse chest tightness with muscle strain, indigestion, or stress. While these conditions can cause discomfort, lung-related chest tightness often feels different, more persistent, and linked to breathing. Infections such as pneumonia can cause chest pain that worsens with breathing or coughing. This pain may be localized to one area of the chest and can feel sharp or stabbing. Even after infection clears, lingering inflammation can cause ongoing discomfort. Another dangerous condition associated with chest pain is pleurisy, which occurs when the lining around the lungs becomes inflamed. This can cause sharp pain with each breath and may signal infection or other serious lung issues. It's important to pay attention to patterns. Ask yourself, does the discomfort worsen when breathing deeply? Is it linked to coughing or physical activity? Does it improve with rest but return with movement? Is it accompanied by shortness of breath or fatigue? If the answer is yes, your lungs may be involved. Chest discomfort related to lung problems can reduce activity levels, leading to muscle weakness and decreased endurance. Over time, reduced activity can worsen overall health and accelerate decline. Ignoring chest tightness can allow inflammation or infection to worsen. Untreated lung conditions can progress and cause permanent damage to airways and lung tissue. It's also important to understand that lung-related chest symptoms and heart symptoms can occur together. If chest discomfort appears suddenly, is severe, or is accompanied by dizziness, nausea, or pain spreading to the arm or jaw, emergency care is essential. Early evaluation of chest symptoms can help determine the cause and guide appropriate treatment. Breathing tests, imaging, and physical examination can reveal whether the lungs are contributing to the discomfort. Chest tightness should not be accepted as a normal part of aging. Comfortable breathing should not feel restricted or strained. When your chest feels tight or uncomfortable during breathing, your lungs may be sending a warning that deserves attention. Next, we'll discuss warning sign number 4, which involves frequent respiratory infections and slow recovery, another sign that lung defenses may be weakening. Frequent respiratory infections or unusually slow recovery from colds and flu are important lung warning signs people over 60 should never ignore. As we age, the immune system becomes less efficient, but repeated infections are not a normal part of healthy aging. You may notice that you catch colds more often than before, or that respiratory infections take much longer to clear. A cough, congestion, or chest discomfort may linger for weeks instead of days. In some cases, infections may seem to return shortly after you think you've recovered. This pattern often indicates that the lung's natural defense mechanisms are weakened. Healthy lungs are designed to trap and remove bacteria, viruses, and debris. When lung function declines, these defenses become less effective, making infections more frequent and harder to clear. Chronic lung conditions such as COPD, bronchiectasis, or long-term inflammation can damage the airways and create an environment where bacteria thrive. Each infection can further weaken lung tissue, creating a cycle of repeated illness. Many people over 60 assume slow recovery is simply part of aging. Others believe they just have a weak immune system. While immune changes do occur with age, repeated chest infections are a warning sign that should be evaluated. Another red flag is needing antibiotics more frequently or experiencing pneumonia more than once. Recurrent pneumonia is particularly concerning and may indicate underlying lung disease or reduced ability to clear infections. Respiratory infections can also worsen other conditions. Each illness places extra stress on the heart and reduces oxygen levels in the blood. Over time, this can increase the risk of heart problems, fatigue, and cognitive decline. Frequent infections often lead to prolonged inactivity. Spending more time resting or bedridden can cause muscle weakness, reduced endurance, and slower overall recovery. This can create a downward spiral in physical health. Pay attention to how your body responds to illness. Ask yourself, am I getting sick more often than before? Do symptoms linger longer than expected? Do I feel weaker after each infection? Have I had repeated chest infections or pneumonia? If the answer is yes, your lungs may be struggling. Another overlooked sign is increased mucus production after infections. Thick or discolored mucus that persists may indicate ongoing inflammation or infection. Over 60? If you're getting short of breath more easily than before, this may not be normal aging. Many serious lung problems begin quietly, with small changes most people ignore. A little breathlessness, a lingering cough, or feeling tired all the time may seem harmless, but they could be early warning signs your lungs are slowly failing. The dangerous part is that lung damage often progresses silently, and by the time symptoms become obvious, the damage may already be severe. In this video, you'll learn 5 critical lung warning signs people over 60 should never ignore. Recognizing them early could help protect your breathing, your energy, and your overall health. Next, we'll move on to warning sign number 5, which involves persistent fatigue and low oxygen levels, often overlooked but closely linked to lung function. Persistent fatigue and weakness are often overlooked lung warning signs in people over 60. Many older adults assume feeling tired all the time is simply part of aging. However, when fatigue is ongoing, unexplained, and does not improve with rest, it may signal that the lungs are not delivering enough oxygen to the body. Healthy lungs supply oxygen to every organ. When lung function declines, oxygen levels in the blood may drop. Even slightly reduced oxygen can cause noticeable changes in energy, strength, and mental clarity. You may feel exhausted after simple activities, such as walking short distances, doing household chores, or standing for extended periods. Some people describe feeling drained throughout the day, even after a full night's sleep. Low oxygen levels can also affect the brain. You may experience difficulty concentrating, memory problems, dizziness, or a sense of mental fog. These symptoms are often mistaken for stress or age-related cognitive decline. Another warning sign is feeling unusually weak in the muscles. Oxygen is essential for muscle function. When muscles do not receive enough oxygen, they tire quickly and recover slowly. This can make daily tasks increasingly difficult. Some people over 60 notice cold hands or feet, bluish lips or fingernails, or shallow breathing. These can all be subtle indicators that oxygen delivery is compromised. Fatigue related to lung problems often worsens gradually. Because the change is slow, many people adapt without realizing something is wrong. They reduce activity levels, take more breaks, or avoid physical exertion. Over time, reduced activity leads to muscle loss, decreased balance, and increased risk of falls. This creates a cycle where fatigue leads to inactivity, and inactivity further weakens the body. Low oxygen also places extra strain on the heart. The heart must pump harder to compensate, increasing the risk of heart problems over time. This is why lung health and heart health are closely connected. Sleep may also be affected. Poor oxygen levels during sleep can cause frequent waking, shallow breathing, or morning headaches. Even if you sleep for many hours, you may wake up feeling unrefreshed. Ask yourself these questions. Do I feel tired most days without a clear reason? Has my energy level declined noticeably over the past year? Do I feel weak or dizzy after mild activity? Do I struggle to recover after simple tasks? If the answer is yes, your lungs may be contributing. Ignoring persistent fatigue can delay diagnosis and allow lung disease to progress. Early evaluation can identify treatable conditions and help restore energy levels. Treatment may include breathing therapies, oxygen support, medications, and physical conditioning. Addressing lung-related fatigue early can significantly improve quality of life. Fatigue is not just a nuisance. When it persists, it is often the body's warning that oxygen supply may be inadequate. Breathing should feel natural and effortless. Shortness of breath, chronic cough, chest tightness, frequent infections, and persistent fatigue are all warning signs that lung health may be declining. If you are over 60, never ignore these changes. Early action can slow disease progression, protect your heart and brain, and help you maintain independence. If this video helped you understand your body better, consider sharing it with someone you care about. Awareness saves health and sometimes lives.